At this point, let's get really practical. Take everything we've been talking about and give people the playbook. And for an example here, we'll use mild anxiety or depression, somebody that's not suicidal, but they've been tuned in to this point. They're intrigued. They want to give this a go. What does that look like, diet and lifestyle wise? And then how long should it take before they notice a difference?
So again, there really is not a one size fits all solution. And why do I say that? Because everybody's different. And that means everybody has different biopsychosocial factors contributing to their anxiety. So anxiety by no means is caused by one and only one thing. Although anxiety disorder, so and again, even in this case, anxiety can be normal. So if you're being bullied and teased every day, you're going to be anxious. That's not a disorder. Changing your metabolism should not change that. The process of being bullied and teased every day is going to make you anxious. It should make you anxious. And the solution is to somehow get the bullies to stop bullying you. But if you have an anxiety disorder where you're anxious for no good reason, or you're hyper anxious, you're just more sensitive than everybody else you know to anxiety, then I would say you probably do have a dysregulation of your anxiety pathways in your brain. And that does relate to metabolism, and you could get better. So what could be causing that? Again, lots of things. You could have low iron could cause that. And that's really particularly relevant for women who are menstruating, because at least probably 10% of women in the United States have iron deficiency because of that. So for them, it might be check your iron levels and get some iron. For other people, it might be low thyroid hormone. So there are lots of reasons, but I'm gonna be a good sport and give you a one size fits all kind of package, or a starter package for you have anxiety, you don't know why, you're a typical American. Let me start with that. You're a typical American. So what do I want you to do? Step one, I want you to clean up your diet. You're probably eating a lot of ultra processed foods. 60 to 70% of the foods consumed in the United States are ultra processed foods. They are not good for you. They're not good for your brain. They're not good for your anxiety. So clean that up. Try to eat real whole foods. Second thing, if you're a typical American adult, about 33% of American adults are not getting adequate sleep. If you're a teenager, if you're a college student, you're probably in that category as well, maybe even higher rates. If you're a college student, you're probably not getting adequate sleep. So what do I want you to do? I want you to get adequate sleep. What is that? Let's go for 8 hours. 8 hours of uninterrupted sleep every night, ideally around the same time every night. So ideally going to bed around the same time, waking up around the same time. I'm a huge fan of light in the morning. So I would get some light in the morning, go out for a walk, open up the window. If you live in a place like Boston and it's the middle of winter, like I do, then maybe get a bright light at your desk or something, but get some light in the morning. If you're not exercising, add some exercise to your regimen. If you're already exercising, I actually find that adding more exercise usually doesn't help. If you're already doing the exercise, you're doing it. Don't worry about changing that up more. And I don't want people exercising excessively, because that's really stressful on the body and it's just really stressful to you. So you don't want to do that. But if you're a couch potato and you really don't exercise at all, try to move your body. It could be as simple as just get outside, that morning light that you're trying to get. Go outside and take a walk around the block. Maybe even pick up the pace and do a little brisk walk. Or if you think you're up for it, maybe a little jog. Even if you have to stop every now and then and catch your breath, do a little jog, walk, do a little jog, walk. If you're using a lot of substances, alcohol and marijuana in particular, I know this is gonna break everyone's hearts. I know other people are gonna yell at wherever you are right now as you're listening to this, watching this, you're gonna yell at the screen or at the whatever. But I want you to back off on the alcohol and the marijuana. Now, the reason I know I say people might yell at me for that is because what I already can hear them. They're saying, but Dr. Palmer, alcohol and marijuana help my anxiety. They help it. And I don't doubt that for a second. They help it in the short run and they make it worse in the long run. And we have abundant data to support that. So that is challenging. If you're hooked on marijuana because of your anxiety, now you're kind of stuck in a difficult place. And I'm going to encourage you to try to get off that marijuana in order to treat your anxiety. But here's the caveat. It means your anxiety is going to get worse before it gets better because you're going to go through marijuana withdrawal. It's going to be hard to get off of it. Your anxiety will get worse before it gets better. But if you actually want to heal and recover, you're going to need to get off the marijuana. If you do not have friends and relationships, family, if you feel lonely a lot, if you feel empty, if you feel bored, if any of those things apply to you more than 2 or 3 times a week, if you feel lonely, empty, or bored more than 2 or 3 times a week, I want you to try to do something about that. Call a friend. Yes, I just said call. I didn't say text. I said call. Like actually bother them and dial their phone number and then talk. Actually let open your mouth and let words come out and talk to them. Because texting usually is not a very good antidote to loneliness and emptiness. Maybe boredom, but it's not a very good antidote to loneliness and emptiness. Whereas talking to people and having a real conversation, like let them know I'm kind of lonely. I'm bored. I would love to hang out. Let's do something. Let's get together. Let's go for a walk in the morning together. Whatever. So have some relationships. You can do stress reduction, but I'm not going to say stress reduction because that's like the cliche. Most people with anxiety have been trying to reduce their stress. It's not working. So I'm giving you the other pointers. But if you have never tried mindfulness or meditation or anything like that, sure, give it a shot. But I'm going to assume you've already tried that and it doesn't work for you and you don't want cliche answers.
Coming back to marijuana and alcohol, are those directly damaging the mitochondria?
100%. We have known, so for alcohol, we've known that since the 1960s. Researchers have tried to figure out how exactly does alcohol poison the liver? Because we know it poisons the liver. And the way it poisons the liver is through mitochondrial damage. Marijuana, same deal. THC in particular is a direct mitochondrial toxin. So yeah, really important to avoid them. The unfortunate catch-22 with them, like I said before, is that yeah, they do relax you, or they do have a short-term beneficial effect. Millions and millions of people would not be hooked on them if they didn't. Of course, they have a beneficial effect on you, but it's short-term and it results in more metabolic mitochondrial damage that then just makes you going back for more and more. And that's how people end up in vicious cycles. And that's how people end up getting hooked on them, how people can become alcoholic, is that they need more and more and more to calm the effects. And it's tragic. It's tragic because the person's just trying to feel better and they're digging their hole even deeper and deeper and deeper every time they try to feel better.
Earlier, we talked about fasting. I'm assuming that would be a good one to add to the list you just shared for the right person.
Yes, I think fasting. So if I would actually start with the things I just said, get rid of the ultra processed foods, eat real whole food. You don't have to go without food if you don't want to. Just like if you try to clean up, do some basic lifestyle medicine things. If those things don't work, then absolutely. Then I probably would next go to fasting and fasting mimicking diets. So some people can fast and they don't mind it. And, initially it can be painful. People get hangry, they get irritable, they might feel weak or dizzy or other things. Um, that is often, if you are one of those people, it actually is because you lack what's called metabolic flexibility. And what that means is that your body is really struggling to go between fuel sources, to stop using glucose and start using fatty acids and ketones as a fuel source. That will change over time. So if you practice at fasting, maybe you just fast for a few hours and then add another hour in terms of intermittent fasting. Just try to get a little longer with the fast. You'll work up that kind of muscle, so to speak. You'll be able to tolerate it better. You'll get better at it. It will become easier. For a lot of people, at some point, you'll start to notice a benefit. You'll go without food. And I mean, like I mentioned myself the other day when I was kind of forced to fast because I just didn't have time to fit in the meals. Um, by the end of the day, I actually was like, yeah, I was like noticing, like, I feel great. I'm like, and I'm thinking, I should do this more often because I actually feel really good. I feel really good right now. And then I ate dinner and then I slept really well that night and woke up feeling unusually better than normal. So, yeah.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
There is zero doubt in my mind as a clinician who works with people with treatment-resistant mental illnesses that ketogenic diets can be life-changing for some people. The very first signs of Parkinson's disease